are the most common mental health disorders. It affects about 301 million people worldwide. But some people cannot even differentiate between anxiety disorder and anxiety. So today, we are going to do justice to anxiety disorder. Anxiety disorder is more common in women, and majority of people who have anxiety disorder don't come to hospital for treatment. So about 1 out of 4 people usually come for treatment. Even those 1 out of 4 people, especially in this part of the world, cannot receive help because of the limited number of psychiatrists and clinical psychologists. So Doctor, you are welcome.
Thank you.
I want to ask you, what's an anxiety disorder?
All right. An anxiety disorder is a health condition where you have this persistent and excessive worrying. The person tends to have undue worry about issues that he or she cannot affect. Is a contrast with a normal with anxiety, which is the normal physiologic panic system or panic system of the body, whereby the body reacts to things. On this disorder, it tends to become excessive worrying without any stimulus. Nothing is going on, and the person is just worrying.
Oh, thank you for your response. How is it different from normal anxiety? Because all of us have anxiety. So how is anxiety disorder different from normal anxiety?
Okay. I would like to use an illustration to expound on this differences between anxiety and the anxiety disorder. Like a doorbell, when you press the doorbell, it rings inside, and the person, somebody responds to you. You see, that is the normal physiologic pattern in which the body is fixed in such a way that when you have things that's going to put you into a panic mood, like a gunshot, you respond to it by that fear, and you are prepared to either fight or run away. But in this anxiety disorder, is like the stimulus is taken away, like there's no more anybody pressing a button and the bell is ringing. The person is persistently in that tense, prepared for flight, and just feared without anything causing the problem. So this is where the difference lies.
Thank you for your response. What are the symptoms to watch out for if somebody is having anxiety disorder? In other words, what are the symptoms of anxiety disorder?
Thank you for this question, because a whole lot of symptoms can be seen in an anxiety disorder patient. Here it ranges from autonomic symptoms, where the person starts to have that awareness that the heart is beating. That's what we call palpitation. Person can have sweating, dry mouth, feeling lightheaded, dizziness, a whole lot. And there is this fear that accompanies this disorder. And most times we call it a free-floating fear, for some types of anxiety disorder, where you just don't understand, don't just know what is wrong, and the person is just afraid for no just cause.
Oh,
thank you.
All right. What are the causes of anxiety disorder? Are there any specific risk factor?
But there are a whole lot of factors that have been considered that can predispose somebody to having this anxiety disorder states. principally genetic factors, have the environmental factors. Some of them have come as a result of the body chemical systems. You know, where you have we've been more predisposed to something like the nature of the job the person does. Like if I'm a military man, I'm more exposed to a whole lot of problems, and if I'm genetically predisposed to this condition, more likelihood to come down with it than somebody else without and not exposed to such conditions as well.
Thank you, Dr. Nnadozie. How can someone recognize if they have an anxiety disorder? If an individual have an anxiety disorder, how does the person know that he's having an anxiety disorder so that he can seek help?
All right, principally, when this starts, usually starts insidiously, and the person will start to feel this way, that he or she are always not settled. The person finds himself getting worried for nothing. The person cannot even place hands on, this is why I'm worrying, this is why I'm not happy, this is why I'm not settled. Any little thing, the person may even start to overgeneralize normal things that he or she will overlook in life as being catastrophic to him or herself. So when you start to see these differences, and when that worry comes, the first thing it takes away from you is sleep. Because you will be on bed thinking, what of this, what of this? So sleep is a red flag to this anxiety disorder. So when someone starts to lose sleep, you're on bed thinking, worrying about things that you may not even have place on, and things you cannot change, becoming excessive, I think you should start to look for help.
Thank you for the beautiful response to my question. So another question, what are the different types of anxiety disorder?
Thank you, because it's important that we understand that these anxiety disorders are not the same. Because it's easy for you to say, okay, this is what now you are sweating, that is the same. No. There are different kinds of anxiety disorder, ranging from what we call generalized anxiety disorder, where the person is always having this free-floating fear at all times, over excessive worry, and the person keeps being on the edge over time. There are these other types of anxiety disorder, like a panic disorder, which can occur with or without agoraphobia. The panic disorder, in that case, the person has this intense surge of fear that is a recurrent. The person is afraid of his life, and the person may now start to have these other symptoms too. You know, he can differentiate it from the generalized way that can occur at all times. Then there are other types of anxiety disorder, like the social anxiety disorder, where the person is afraid of being judged or being embarrassed in societal, in the social settings. Like person want to come out to talk to people, and you know, the person can just start to become fidgety, sweating, and can't even talk. You know, have situations like that. Then the other specific anxiety disorders, like the phobias, where the person is afraid of specific object, thing. I have this friend that till date he cannot even stay with near where there is a live chicken. You know, just a live chicken coming around puts him in this intense fear. He can run, he can pay money to get away from the situation. So there are specific anxiety disorders like that. Then it goes down to having some other illnesses that can even have anxiety as a component, like the obsessive compulsive disorder, where the person keeps having repetitive thoughts, intrusive thoughts, that comes into the person, if the person doesn't go to do those things that he or she wants to do, the anxiety keeps building up, but he goes to do that before he gets to relief. Even the post-traumatic stress disorder, where because of the person being involved in a life-threatening event, the person starts to develop fear about such similar situations or that kind of situation that gives that kind of thought. So these are different kinds of anxiety disorders.
Okay. So now we know that there are different types of anxiety disorder. Anxiety disorder is not just one. We have panic disorder, we have social anxiety disorder, we have phobias, we have obsessive compulsive disorder, we have post-traumatic disorder. So is this condition, can it be treated? And
yes.
How can we treat it?
Yes, a treatment of cases usually will come when people understand the problem. So, anxiety disorders can be treated. They employ use of medications, psychotherapy, that's talk therapy, and the treatment actually is done by specialists like the psychiatrists and the psychologists with the social workers, with also the psychiatric nurses. So anxiety disorders can be treated well.
All right, thank you so much. What about somebody changes his lifestyle? Can he help managing anxiety?
Definitely, when we talk about having therapies go a long way to identify exactly what may have precipitated or what is perpetuating the problems. And if it's noted that the lifestyle is either have precipitated or perpetuating the problems, change of lifestyle may be advocated, and the therapy is structured in a way that it helps you to seamlessly go through this change without problems. And their point is to improve your quality of life by caring for the anxiety.
So lifestyle changes can help us, like giving good diet, regular exercise, avoiding drug that can affect the brain. It can help us to thank you, Dr. Inarusi, for that insight. So how can friends and family support someone with an anxiety disorder?
Oh, very good. Because when someone comes down with this disorder, there's this problem that the person may encounter, especially in this side of the world where people tend to ascribe things they don't see or touch to spiritisms. They can argue, they can advise the person into not understanding exactly what is going on. So friends and family relatives can help to, if they understand the nature of the illness, help to support this person, to give the person hope. Perhaps there are pressures, like there are persons that even with the illness are still put under a lot of pressure that will only worsen the illness. So friends and family, if they understand the illness, can actually come in that dimension to give a whole lot of support to help ease some of these pressures and thereby helping the person come out of these anxiety problems.
Thank you so much. The family need to be supportive and non-judgmental. So it can also encourage the patient to seek for professional help. So another question that I want to ask is that is anxiety disorder a lifelong condition, or can it be cured?
Well, anxiety disorder can be treated. Your treatment is by some specialist. So it's important to go see the specialist and follow the counsels of the directions of the specialist, because over time the specialist may adjust your medications or tell you or give you drug holidays depending on what he or she has seen. So drug anxiety disorders can be treated.
To buttress your point, have some of these people that have anxiety disorders even have been at least go on to live a normal life without having even anxiety disorder. Though some percentage of people will still need to continue to follow even after treatment. So the next thing I would like to ask is to what advice would you give someone who's currently struggling with anxiety?
Well, the first advice I'm going to give is that before anxiety came, you were living your life, and for it to have come means that just like before someone comes down with an illness, it means that it has broken the person's defense mechanisms. So before anxiety comes, it means have broken through your regulatory mechanisms, and you need help. So once you notice some of these symptoms, it's important to talk to a health practitioner, especially the specialist, the mental health specialist, and they're going to take you through the treatment protocol that you will achieve sound health in the best and time.
Thank you. Finally, I will ask you, what is the most important thing for people to understand about anxiety disorder?
Okay. Principally, people should understand that anxiety disorder is not from the village. It's important. It's also understand that anxiety disorder is not from, and that it's not something that someone has or thrown or done to you. But then you also know that anxiety disorders are medical illnesses, just like malaria, just like every other medical illness, and they can be treated. They have been treated in the hospital by mental health experts. So avail yourself the opportunity. If you have any of these symptoms, talk to the mental health experts. Thank you.
So, thank you, viewers. So you have been listening to Dr. Otun Inadose. He is a mental health expert. Works with Federal Medical Center, Umaya. I think he has given justice to anxiety disorder. He has told us that anxiety disorder is real, it's a medical condition, and it can be treated. Only what we need to do when we're having anxiety disorder is to go for it. Thank you for Dr. Inadose for your time.
Thank you, sir.
I'm very grateful. Next time we'll still be calling you to come and give us a site for other mental health conditions.
Thank you for having me.
Thank you.
Thank you.